So for all intensive purposes, because it's illegal to use a drug that isn't approved of by the government, and the government creates a system where if you don't have a patent, you won't go through it. Because if it's going to, even let's say it only costs $200 million, we've got a simple application. Well, you won't go through that process because as soon as you get approval, you don't have a patent, anyone can just piggyback. They don't have to do the studies. So they can, well, it's proven to be safe and effective. I'm going to make it exact same molecule as them, exact same dosage, exact same instructions. Bang, you're in, right? Like I like to use Viagra as an example. Like, remember when Viagra was approved? There were news stories about how expensive a single pill cost. Like it would be, this back in the 80s or whatever, like $20 a pill or something. Like that'd be the equivalent of several $100s a pill now. And Pfizer could charge that because they had a patent. So they get through the new drug approval process. They get approval to sell. No one can compete with them, so they can charge whatever they want. Well, now the patents run off. The generic name is Sildenafil. And it costs nothing now because there's people competing with them. So it would be more honest if we amended the Food and Drug Act and just explicitly said in Canada, it is illegal to treat a serious health condition with anything but a chemical drug that had a patent when it went through the drug approval process, because that's our reality. So we don't say it, but that's our reality. So you tell me how we have good health outcomes when we've made it law. We've made it law that you can only treat serious health conditions with chemical drugs that had a patent. Now, what's happening with the self-care framework is they're lowering the bar to medium and minor health conditions to make it so expensive and so onerous to get through the approval process that we're going to lose all our natural products because we can't afford to go through it. So, and that's why it's important to understand the drug model, because it's a complete fraud.